Have you been diagnosed with osteoporosis or osteopenia? Do you want to build bone strength, to build muscle strength, to build balance in a way that is safe? Do you want a yoga practice that helps you move into healthy aging? Well, you're in the right place. My name is Beth. I am a licensed clinical psychologist and a yoga teacher. I have a certification in yoga for healthy aging. I'm 57 years old myself, and I have a diagnosis of osteopenia myself. So I am definitely interested in yoga practices that help me stay strong as I get older. Today's practice, we are going to focus on yoga for bone strength, particularly in the area of the wrists. We'll be practicing 6 poses. Now, this is based on the research based work of Dr. Loren Fishman. He did a lot of research into 12 poses for osteoporosis. So, we're going to do a variation on 6 of those poses today, and we're going to be using a chair for additional support and safety as we perform the poses. Every pose will have a variation, a modification that you can choose if you desire. So if you're ready, grab a mat, have a chair nearby on your mat, and let's get started. So most of the poses that we're going to be doing today are going to be placing some weight on our hands to help build that strength in our wrists. Again, I will show you modifications so you can determine just how much weight to put on your hands. We'll be holding the poses anywhere from about 30 to 45 seconds. Dr. Fishman generally started with 30-second holds. You can work up to longer than me, a minute or more. Start facing your chair. Our first pose is plank pose. So I'll show you the version I'm going to do, then I will show you a couple variations, then I'll come back to my version. So I'm going to do a version of plank where my hands are on the chair. I'm going to use my hands on the edges of the chair and then walk my feet back. My body is long like a plank shape. So that's the version that I'm going to be doing. One variation is to bring the knees down, lean your weight forward any amount. And so there won't be quite as much weight into your hands in this version. You can also be on your forearms, and you can be on your forearms either with the knees down or with the legs straight, heels pushing away from you. So I'm going to come back up. Again, we'll do about 30-second holds and we'll start with our plank now. So decide on your version. Set your body up so that your abdominals are engaged. Your hands are supporting you, or your forearms if you choose the forearms. So this is a pretty strong pose that we're starting with today. Make sure that you can access your breath. We're not holding our breath in any of the poses. You can think about being a long line from the soles of your feet, maybe even pushing the heels a little further away from you to the crown of your head. Perhaps inviting in 1 or 2 more breaths here. Then slowly you can walk your feet in, come to standing or rest on your chair between poses. The next pose is going to be a side plank pose. Now for a side plank, again, I will show you the version that I'll do, and then I'll show you a couple of variations. I'll do it facing you first and then facing the other way when we do the second side. So the basic side plank, similar to our full plank, hand on the chair, legs extended. They can be stacked, or I'm going to do a staggered leg version for a little bit more help with balance today. Your top arm can rest by your side or overhead, wherever you choose. So our first alternate to side plank is going to be a forearm, just like I showed you that alternate for the first version of plank that we did. And then our second version of side plank is going to be a gate pose where you extend one leg out under your chair. You can do that however you have room to do that. Put the same hand as extended leg on the chair and then reach up and over your chair. So you're getting that same side stretch with less weight on the hand. All right, choose your version. I'm going to come up to that first version that I showed you, hand on the chair. You can hear that already I'm starting to have some exertion, maybe get out of breath a little bit, and we'll start our hold for about 30 to 50 seconds. Now your head, when we're doing poses like this, can be wherever is comfortable on your neck. So this is a neutral spot I have now with my gaze relatively forward, my chin centered. You might also choose to look down or to look up. And we'll just take one more breath, maybe one or two, in this pose. And then I'm going to set my knees down. So here's where I'm going to turn around and face the other way. You have the same options on side two. Let's get right into it. Place the hand. If you're doing it like me, you want the hand pretty much under your shoulder so you can stack your joints for a little bit more support. Remember, top arm place wherever you'd like. You can try it overhead. And then make sure that you can continue to access your breath. It may get a little bit ragged like mine. And I don't know if you can see on camera, but I've got some shaking going on. So I'm going to take about one more breath here. And then once again, come down to knees. You can always sit on your chair. We're doing, as you can see, mostly standing poses. Take a break whenever you need to or pause the video. All right, next we're going to do side angle pose. Side angle pose is a little bit more leg strengthening, a little less weight on our hands. We'll start standing here, and I'm going to have my one leg facing the chair. Other foot is kind of out toward you, a little bit on an angle. So for side angle pose, the leg that's facing the chair is going to be bent, and you might have to scoot a little further away from your chair. You can absolutely have the shin resting right on the chair. That provides a little more support. It's another lateral bend, a lateral stretch. So we're also getting some strengthening around the hips. That's where I need it. I have the osteopenia on my right side. This is the version I'll be doing with hand on the chair, and this time I might raise my arm overhead or over my ear. So a little bit more of an upright version is to put the hand on the back of the chair instead of the seat. If that feels too far away, definitely just turn your chair around. And then one more version, I've got some blocks here. So you can easily place a block, something to make the chair a little bit higher, and then I don't have to reach down quite so low in my side angle pose. Choose your version, place your hand where you want to place it, front knee bent, hinge from the side of the hip, back leg long and extended, back arm can rest on your side the same way I did in side plank. It can go to the wrist, or if you'd like, you can choose to take it somewhere up overhead, knowing that if you add the arm further away from your body or up overhead, that is going to add to the load. The stress on your body generally tends to make the pose a little more challenging, a little more difficult, activating a little bit more muscle and bone response. All right, let's find one more breath in on this side. And you can give a little push into your feet and your hand to help lift yourself up. You can flip your chair to the other side. I'm just going to turn around. So it's your second foot that faces toward the chair. If your chair has shifted, move it around. Open your legs wide so that your front knee can be bent approximately over the ankle. Remember, we have other variations where you can place your hand on a block or the back of the chair. Hinge from your hip crease. Place your hand. Decide what you want to do with your top arm. And then we'll hold here. Now, while you're in the hold, something that both Dr. Fishman and then another medical doctor who does work on yoga for healthy aging, Dr. Baxter Bell, recommend is feeling that you can hug the muscles in toward the bone as you're holding. So you're activating the muscles. That puts a little bit more stress on the bone, and you want that stress in order to strengthen the bones. All right, we're in our final breath here. And then again, we push in with our hand, push in with our feet, come to stand, Scooch the feet back together. And next we have a downward dog, chair downward dog, or a variation of puppy pose, which is on our knees. So I'll show you the version I'll be doing, I'll show you puppy, and then we'll come back to dog pose. I'll show you two versions of downward dog. So the first is similar to plank, but instead of extending my legs out so that I'm in the plank pose, I'm going to be hinged from my hips, walking my feet back so that my arms can extend long. My head comes somewhere between my arms, and I keep with this long extended back as I press into my hands. Send my tailbone in one direction, the crown of my head in the other. Now you can absolutely do this chair version with the hands on the back of the chair instead. So here you're a little bit more like an upside down L shape, but still gives you a really nice extension in the spine, still puts a little bit of weight on the wrist, but may lessen that for you a bit. And then I'll show you the knee version. This is often called puppy pose. So we walk the knees back just like we did, fold, slide the hands along the chair. So you have the same extension of the back, not as much weight on the hands. I'm going to do that first version that I showed you on my feet. Find your version of downward dog for this practice and start to settle in. Remember that concept of activating the muscles. So here it's the hamstring muscles on the back of the legs. I can feel the activation of the muscles around my arms, my biceps. Muscles in your hands and your wrists are activating. Think of all the muscles necessary to hold you into that pose, and then use those muscles. Really, it's using your mind, part of the mind-body connection. Use your mind to activate those muscles to increase your strength benefits. All right, we'll start to walk in here. That was 4 poses. We have 2 more left. Our next pose is going to be a twist. Dr. Fishman shows the twist seated. The seated is going to be an option. I will show you a standing version first that's going to add a little bit of a balance element, a little bit more of a balance challenge to the pose. So for the standing twist, you'll step 1 foot on the chair. Make sure you feel balance. And then you're going to turn to the bent leg. Now you can stay upright like this. That's your first option. I'm going to take the option where I put my hand on the back of the chair and extend my opposite arm. This helps me move my spine into the twist a little bit more. And then you can also take a seated version of the twist. So if you're seated, you sit right on the edge of your chair. You're going to keep one leg bent, extend the other leg. Sit really upright. We want to start all of our twists upright. And then same as standing, you're going to turn in the direction of the bent knee. And same, you can hold over your thigh. You can hold somewhere in the back of the chair. If you have a chair that allows you to press your back hand into the seat of the chair, that's where you can get a little bit of the weight on your arm and a little bit more wrist strength in that area. Okay. I'm going to do the standing version. So remember, that's 1 foot on the chair. Make sure you feel a little bit balanced before you start to twist. Twist around the area of your thoracic spine or the ribs. Stay upright, or if you're doing this version with me, let one hand rest. A little weight on that hand, again, for strength. Open the opposite arm, and we'll hold. Remembering that you can choose to turn your head wherever that is most comfortable for your neck. And I'm actively pressing down into my foot a bit here to activate the muscles in the bent leg. Also the muscles behind my back, my upper back, my shoulders. I'm drawing the shoulders actively together for this last breath. And spin back around, take that foot down. Now, depending on what's going for you on with your body from side to side, You might choose a different version for side two. You can absolutely go to seated on side two. If one side of your body feels less stable, maybe you have an old injury, choose what works for your body. I'm going to find my balance here, find my body upright first, and then I'll find the twist. I'm twisting first and then finding this little bit of a lean, placing my hand on the back of the chair, reaching the other arm out and away. Still breathing into my pose. Still activating by actively pushing my feet, not just the foot on the chair, but the foot that's on the floor. Drawing the other muscles to engage. Hold me in the pose for another breath or two. And then come back around. Time for our last pose. This is going to be a bit of a back bend. Again, it's going to be a pose we'll either do standing or we'll do on our knees. So I'll show you the standing version first. So for the standing version, I'm actually going to come down to seated, and then the hands are going to go on either side of the seat, sort of similar that we did facing the chair in plank. This time I'm going to walk my feet away and then take my bottom off the chair. So you can also think about this as a reverse plank or a bridge pose. So this is the version I'm going to be doing. Draw the shoulder blades together on the back, and then you can keep the knees bent as I'm going to do. You can push further into your hands. You can also choose to take a full reverse plank by taking your legs straight. I'm going to be doing this more reverse table version. So that's one version. For our floor version, our knee version is a variation on camel pose. So you're on your knees, move back close to the chair, and then we'll take our arms behind us like wings, and you'll see where your placement feels best on the chair. I think for me, I like the palms on the chair, but you might also like to grab the sides of the chair, still drawing your shoulder blades together, your elbows back. And then because it's back bend, we're stretching across the front, so our chest lifts. And we breathe. All right, I'm going to go back to you seated on my chair to set up for that pose. So when you're ready, find this last pose, decide what level of effort you feel comfortable putting into this pose. Make your own appropriate amount of effort. So for me, I've decided it's appropriate to really push into my hands, to lift my hips up, but to keep my knees bent. And then I feel like I can start getting the expansion across my chest. I'm keeping my head pretty neutral rather than letting it drop back. Ending like we started with a pretty strong symmetrical pose. Take a few more deep breaths. Maybe we'll go for just a little bit longer in this pose, but of course you come out of the pose when you need to, when you're ready. It's your body. If you're here, take one more breath with me. All right, and then you can help yourself down to the floor or to the chair. How was that practice for you? Where did you feel the most effort? Where did you feel as if you were getting some strengthening work in your wrists? Did anything bother you or hurt you? If so, we need to adjust. Ask me a question down in the comments and I'll let you know what adjustments you could make for your body. I hope you enjoyed this video. I have other videos in the series based on Dr. Fishman. I'll link to them in the description below. Please subscribe if you want more videos that are focused on healthy aging. Enjoy the rest of your day.